Welcome back. Your body needs cholesterol, but too much can raise your risk for heart disease and stroke. And a statin alone may not offset unhealthy habits. Here's Viv Williams with what you can do to help that medicine work better and why some people may still need medication even with healthy habits.
If you have high cholesterol, the American Heart Association says that statins are the most effective lipid-lowering medications for most people. But taking statins does not mean you can let your healthy lifestyle choices slide.
If someone comes to me and says, "Doc, give me this statin so I can eat what I want or do what I want with my lifestyle," I say it doesn't work that way.
Dr. Stephen Kopetsky, a Mayo Clinic cardiologist, says statins reduce your risk of heart attack and stroke by blocking the production of cholesterol in your liver. That means less ends up in your bloodstream where it can accumulate in your arteries. He says statins are important medications, especially for people who know they have coronary artery disease, because the medication will reduce their risk of cardiac events. But he adds that statins are not a magic bullet.
We know if you take a statin but don't change your lifestyle, the statin doesn't really work very well.
Why not? Kopetsky says lifestyle choices, exercising regularly, not smoking, maintaining a healthy weight, eating a heart-healthy diet, and reducing stress improve the health of your arteries and overall health, making a statin's job easier.
If you don't have disease, I don't like to push statins on people. I'd rather have them change their lifestyle.
But is it possible to lower cholesterol on your own without the help of a statin?
You bet you can do it on your own.
Kopetsky says many of his patients have done it over time by gradually introducing healthy diet and exercise habits. But he also notes that some people, no matter how hard they try, can't keep cholesterol levels low because their bodies are genetically wired to produce excess cholesterol. He says this group should consider taking a statin in addition to incorporating a healthy living plan.
I was so glad to hear how well-rounded his answers were and that he was saying maybe you could get off statins and just talking about the whole picture.
Yeah.
You know, some people may need the statin for right then and there, but you still have to address why you're getting it. And the underlying things that drive it usually are inflammation, or damage to the blood vessel. That blood vessel gets damaged, then the cholesterol is going to go to try to repair it. So if you don't stop what's causing the damage, the inflammation, you're going to keep putting more and more and more cholesterol, and that's a plaque. And the other thing is insulin. If your insulin is very high, that's going to drive you to start making a lot more cholesterol. And cholesterol is not necessarily a bad guy because hormones are made out of cholesterol. All of our cellular membranes are made out of cholesterol. So it has to be taken in context.
But if you would consider making the lifestyle changes, you could feel a lot better and get off of maybe medications that have other impact to your health.
It's all the
side
same
effects.
foundation. I mean, look at it. Every time we look around, we're talking about inflammation. How do you stop it? Stop eating processed foods. Stop, manage your stress. Exercise, walk. It's the same foundation. It affects every different disease. This was no different.
What are some other things that people could ask their physicians about, maybe like hormones or GLP-1s or other things?
Still comes back down to the basics.
Okay.
You can't out medicate nutrition.
Yeah. No, exactly. And I think when they say exercise regularly, I wouldn't complicate it, like walking.
Walking's simple.
Walking simple. When they say reduce stress, I think about worry. Stop worrying.
Yeah.
Well, I'm glad you mentioned worries because so many older adults are so burdened with worries. So anything you can do to kind of bring yourself some calm, and a good way to do it is exercise.